The Kingdom of Tonga and its citizens pride themselves in their rich culture and traditions, which foster values of love, respect, maintaining good relations, and the passionate commitment to do good. Amongst the 32,000 of its youth population, which makes up a third of the country, the majority belongs to Christian denominations. Given the common conservative views, very few young people have the courage to stand up, speak up, and advocate for issues such as sexual reproductive health rights, a subject that is perceived by some to be taboo and private. Sosua Sefesi, a Queen's Young Leader awardee, is a brave young man who has dedicated his youth years to be an advocate for sexual reproductive health rights.
When I was 13, I had my first sex talk, my sex education from my mom. And I thought it was normal in every Tongan household, but I was wrong. When I was 17, a friend of mine from school, I was a prefect, and he came up to me and asked me if I can help him with he got an STI. We went to the hospital. It was too crowded. We were scared and embarrassed because we're there because someone has an STI. But we didn't know at the time it was STI. But I told the auntie, and auntie directed us to Vava'o Family Health Center. And we went to the clinic. Surprisingly, we saw another friend of ours. She was one of the top students of our year. And we found out why she was away from school, that she was pregnant.
Back in November 2019, Her Royal Highness, Princess Angelica Latufoipeka Tukuaho, led Tonga's delegation in a commitment to have zero unmet needs for family planning information and services, zero preventable maternal deaths by 2030, and zero gender-based violence by 2030. It's almost a year since that commitment. But where are we with the youth of Tonga? Here are a few at the forefront of youth work for different communities.
Over times we have different programs. When I was started with Tonga Ladies Association was only focusing on HIV and sexual reproductive health. Well-being of our members is our priority. Not only that, but working on non-communicable diseases. It goes along with our Miss Galaxy pageant, which is our program that our platform which to use to voice and promote raising more awareness.
Ko mea lahi koko whae ko tau te whito ke media, ko lai tā pe video, whaafan short documentary, o toku ate social media, pe ko Digi TV. Ai whiawhi whalaite ko tau pe, poi hawhi hoa pe ulere mo prokalama ko ni tara no pe ngahi topiki ke pe a ko au kawai teenage pregnancy, cyberbullying, violence, gender equality, toxic masculinity.
One program that TLA always does is peer education, which that camp is on about now. We reach out to young people, especially youth, to see what values that they have and knowing that they can be role models to others as well, especially with the LGBT community. So with the HIV testing, it's happy to see that the numbers are growing. Before it was like just 5, just 6, and now we every time TLA raise the target, we try to reach the target. And everyone, right now, everyone's just, when we say HIV testing, everyone's just like, yay, let's get tested, you know? And the results is always negative, which is really good. So yeah, I believe that's the positiveness of getting tested.
The Legislative Assembly of Tonga held the Tonga Youth Parliament earlier this year, hosted the She Leads program with the help of Tonga youth leaders, and then followed up with Ducky Youth Hub as a follow-up Zoom conference. The national platform brought many young people to discuss issues prevalent amongst youth, including challenges under sexual reproductive health rights. Still, there is more to be done. In its health facility readiness and service availability assessment of the Kingdom of Tonga, the Ministry of Health reports that only 2 facilities within Tonga can be said to provide AYF services according to global standards. None provided rape kits or bags or kits to store evidence. None of the 31 health facilities can be considered gender-based violence service ready.
I got the ego not to fit my not to no more. They know where we are. They know how. We know about that big leaky in my feet to that I don't hang up bullet in a title to poo. Các quan mẹ nhau của cô mà hai pha là cả hai mươi palima cái tàu là vậy tàu tôi cái tàu pha phít pha bột bột cái tàu tôi cả cái tàu mà là cái tàu get the information figure out.
Although a few young people were lucky to be informed on SRHR issues, some still do not access the service and contraceptives for various reasons.
For example, if I go there, I need help, okay? And the first thing I will ask them, is this confidential? And they will say, yes, everything here is confidential. And they give you the smile. And then next you hear is that your stories goes around like rubbish.
That's the main reason I think the youth, they can't even go and get what they really need and want. If you start walking to like one of the clinics or the health center, people start talking and like it's prevent them from going there.
It takes courage, but I think most people won't even come out that they need help unless it's too late. And then they realize that they really do need help. But I think one of the things they don't like going to the clinic and stuff because it's not youth-friendly. Yeah? The clinic staff or the hospital is very judgmental. So I think our clinics and hospital staff, they need to be more youth-friendly and know how to handle cases as people. Like wear the shoes of the victims and people who does need help.
It has only been a year since the Nairobi summit, but there is indeed more to be done for the youth of Tonga. More education, more awareness, more advocacy work, and more adolescents and youth-friendly services.
Ekumanadu, nusinhe